This is Kaiser Health, bringing the health industry to families, corporations, and you. Talk with Lenore Kaiser at 599-5555 or 800-299-KTSA.
Hi, this is Lenore Kaiser with Kaiser Health Talk, and today's show is brought to you by Kaiser Medical Management. You can find them at kaisermedicalmanagement.com or 1-800-764-0418. And if anybody wants to call in and ask the experts any questions, they could call 210-599-5555, or long distance is 1-800-299-KTSA. And today we are going to be talking with Dr. James Weiss in regards to bioidentical hormones, and later on we'll be talking to some other folks, a group of Bradley and Eric and maybe Matt, in regards to the Total Financial Group, and it's about being able to help companies with saving on medical expenses. But first of all, we are talking to Dr. James Weiss. How are you doing?
Great. How are you today? Congratulations.
Thank you. Yes, I just came back from Houston literally less than an hour ago, and was doing a competition. Got first place. Great. Yay, woo.
Yay, woohoo.
But I'm really excited about this topic because we got a lot of women that responded by email and by Facebook and also on our site.
Great.
In regards to the bioidentical hormones. And apparently there's a big need or interest in this. So first of all, I want to ask you, what are bioidentical hormones?
Bioidentical hormones, to begin with, let me just say they're on the controversial side, but that doesn't necessarily need to be so.
Why is that?
Because traditionally women have used non-bioidentical hormones.
What's the difference?
Okay. But bioidentical hormones, let me answer your first question, are hormones that are chemically identical to what the body makes. They're made from natural organic substances or synthetic sometimes, and therefore are used similarly to what the body naturally uses, the natural hormones.
Okay, so how would you know if you needed them, or what? Yeah, I'm just asking as a personal because I am over 40. So,
well, women are using them today because they can be helpful, and they can be helpful because women have problems with menopause and premenopausal symptoms, so they can create a natural solution to women's problems. Okay. They also are used in men. Testosterone is used as a natural bioidentical hormone as well. But today's subject is women.
Okay, great. Well, I like that. And why do women use them? The same reason? It's because they help with...
Women are using them because bioidentical hormones, because they can provide an exact dosage for what they need and a natural solution to menopausal and premenopausal symptoms.
Okay. Can you name some of them?
Sure. For women, the most common ones that are used are progesterone and estrogen. But women also use other bioidentical hormones such as DHEA and or testosterone.
Okay. And tell us about the sort of patient that you may see as far as that would need something like this.
For example, I recently saw a 40-year-old female who came to me with what I would call pre-menopausal symptoms. With reduction in progesterone, they had reduction in progesterone noted by lab analysis. The lady had she had a combination of agitation and a lack of progesterone. And when there's a lack of progesterone, there's a relative estrogen dominance. Estrogen dominance is usually seen in this particular case with too much estrogen or a lack of progesterone. In this particular case, she had agitation and difficulty sleeping and headaches.
Okay. So I've heard of something called estrogen dominance. What does that mean?
Estrogen dominance is a constellation of symptoms of agitation, tender breast, weight gain in the hips, headaches, PMS, and it's characterized by too much estrogen. It can also be characterized by bleeding changes. It may be seen with some deficiency of progesterone and a normal estrogen level. I know I'm throwing out a lot of different terms for people.
Yeah.
It may be seen more symptoms when estrogen is elevated and a lack of progesterone. There's a combination, there's a balancing act between estrogen and progesterone. So if a person has too little progesterone, relatively they have too much estrogen. Or if some women have too much estrogen and a normal progesterone level, their estrogen is just too high.
And as far as, again, I'm talking on a personal note, what age group starts seeing this type of change?
Well, you can get premenopausal symptoms even 10 years before menopause. So it can be anywhere from as early as 30 to 50 or 60.
That's interesting. So how does progesterone and estrogen work together? I'm sure that you need both, I know, but how do they work together?
Estrogen and progesterone are the female steroid hormones that act synergistically to prepare the female for reproduction and sexual activity. Estrogen also stimulates the brain and helps retain salt and water, allows ovulation, lubrication of the mucous membranes. Progesterone, on the other hand, it calms the brain, it causes diuresis, or when somebody urinates, they diurese, and prepares the uterus for pregnancy.
Oh, that's okay. Knowing that, I'm sure that y'all have to test for this. How do you test for the imbalance and deficiency state? Do you do blood work?
Well, yes. To begin with, a thorough, complete history and physical is done, and follow up by any tests that haven't been done on the woman, such as preventative tests, such as Pap smears, pelvic exams, or mammography, for example. Then a dialogue takes place in which time recommendations and explanations of risks of hormone replacement and other genetic evaluations that may be suggested.
Okay, so is there a blood test? Just I don't know if there is or not.
A blood test for estrogen and progesterone, yes.
Yeah, okay.
There's also blood tests for other hormones as well, and there's other hormones that are related to estrogen and progesterone, such as FSH, follicle-stimulating hormone, luteinizing hormone, and a cadre of other hormones that we check for routinely for women.
And so are those part of the tests that you do? Like what other testing is important for women? Is that some of them that you're talking about?
Yes, complete hormone screening is done, especially for women that are over 40 or any hormone imbalances. This can happen through the natural aging process. The hormone levels decline, the binding globulin hormones can rise, so the amount of free available hormone levels declines. These may be seen with even normal lab values, especially if complete testing is not done. And there's a thing called sex hormone binding globulin, which binds the free available hormones, so that even though you may have a normal estrogen level, the amount of available free estrogen may be low. Also, elevation hormones also are very important because even though, in my opinion, there's a slight increased risk with some types of hormones, especially estrogen, especially if it's a non-bioidentical hormone, there's an independent risk of cancer as women age, for breast cancer, for uterine cancer, even without the discussion of hormones on the table, just as an independent factor.
And so, this is also very important for men to know as well that, that are involved, because if they start seeing changes in their women, what type of changes would they be looking for that show that this is going on, or this is a possibility that's going on as far as changes in the hormones? What is it that a woman would be looking for?
Like I was suggesting earlier, if a woman had a certain personality and then she all of a sudden started getting agitated and depressed, or couldn't sleep well, or her breasts were tender to palpation, to touch, any numerous factors, but those would be a constellation of findings suggestive of estrogen dominance. And that is normally what is the first thing that is seen, a lack of progesterone. Women usually decline in their progesterone before their estrogen levels start declining.
Yeah, that's definitely a good sign for them to possibly get a checkup with you. Other hormones that impact the estrogen and progesterone that you would, recommend or want to talk about?
Testosterone is another hormone. It's the male hormone, but women need it too in a certain low dose. And it's important that that be checked also with estrogen and progesterone. For example, as a woman gets closer and closer to menopause, generally women will start making more adrenal hormones, and the adrenal hormones cause an increase. This is a very complicated subject. They increase the level of testosterone.
Women are complicated.
Women are talking about male hormones is much simpler and easier. Women are more complicated. We all know that. Women know that. Men know that.
Absolutely.
But we love you.
You know what? I know.
Love you.
Men are like a little off and on switch. Women are like this studio. There's a lot of buttons that we could be pushing right now, but we're not.
Even the discussion that we had last week when I said to you that a little bit of estrogen for a man is important, but too much estrogen makes them agitated, just like a woman that has too much estrogen, they get agitated.
Well, that's interesting. So do men need estrogen?
Absolutely. Actually, they need it as far as their development as a man. They need a little bit of estrogen, not a lot, not too much. If a man has too much estrogen, even if they're taking, let's say they're taking exogenous testosterone, if they take too much of it, their face gets all flushed and red, like his, but I'm not saying he has too much. Like the man I'm looking at in the studio.
You have way too much estrogen today.
I don't know if that's
Bradley
true.
Is sitting in right now.
Right.
So.
And also their breasts enlarge, called gynecomastia, if they take too much estrogen. That can happen naturally as well. I'm not saying he has that issue. I'm just saying.
I'm just laughing because Bradley's like, why am I in here?
He's sorry he stayed for this interview.
We might interview you. You need testing done. What exactly does estrogen and progesterone do?
Progesterone and estrogen, I'm sort of repeating myself a little bit because I want
that's okay.
I want everyone to be clear on what we're talking about. Progesterone and estrogen are anabolic female steroid hormones, and they help prepare the female sex glands to be ready for fertilization and are also needed for arousal and stimulation for normal sexual activity. And let's not forget one other factor. They're also needed for various other organ systems, including the brain, the bone, and other hormones. So they're not just related to the female sex hormones and sex organs and sexual function.
Okay, well, great. We'll be taking a break, but if y'all want to call in and ask some questions to Dr. Weiss, you could call 210-599-5555. When we get back, we'll be talking about how long the treatment lasts for women and as far as other questions that have to do with bioidentical hormones. You're listening to Kaiser Health Talk, and this is Lenore Kaiser.
Bringing the health industry to families, corporations, and you. This is Kaiser Health. Talk with Lenore Kaiser at 599-5555 or 800-299-KTSA.
Hi, this is Lenore Kaiser with Kaiser Health Talk, and today's show is brought to you by Kaiser Medical Management. You can find them at kaisermedicalmanagement.com or at 1-800-764-0418. Right now we are talking to Dr. James Weiss in regards to bioidentical hormones, and I got lots of questions for him just because I'm female and I'm over 40, and I'm just as interested as anybody else that's over 40. But I want to know, as far as when you treat somebody and for something like this, how long is the treatment for women?
Well, there's different types of treatment for different women, but I'm just going to make a couple of blanket statements. One, treat the women as long as they need to be treated. Reduce the symptoms of the effects for lack of estrogen and progesterone. Also, you have to look at the individual patient and disease management. For example, if a woman has osteoporosis, she may lack estrogen. She may need to be treated longer. Also, if there is an increased risk of cancer and genetic dysfunctions are real, we must consider an individual approach. Some bioidentical hormones have also been shown to decrease the risk of diabetes mellitus. I think that the key is to balance the hormones. Also, some hormones may reduce the risk of cholesterol and be helpful in management, and also for hypertension.
Okay, so do you replace the levels to like a youthful dosage?
No,
or?
I don't do that. When I started out doing bioidentical hormone replacement, there was a big drive to replace everyone at this very youthful level. I replace the levels to give symptom-free disease and an improvement in lifestyle. I also take a look at every individual, every woman's preferences and beliefs. Each lab will provide an average value of levels for an individual progesterone or estrogen level, but this is an average 30-year-old value. So we can't completely look at just one lab value and treat a person. We have to treat the person as an individual. But that does not tell us what the maximum physiological level is for you. This level should not be exceeded for you. And other factors such as I mentioned, sex hormone binding globulin should be looked at to determine the correct level for you. An individualized approach, just like your thumbprint is individual. You're different than him, that guy over there.
Well, I totally understand that. I hope so. No, I love you, Bradley, but I don't want to be like you. But if anybody wants to call in, you could call 210-599-5555. Long distance is 1-800-299-KTSA. As far as anything else that somebody could do for their lifestyle to help it make it better, what would you recommend?
I would recommend that hormone replacement, bioidentical hormone replacement, is just one thing in a myriad of things that are important. Nutrition is very important, exercise program, meditation, and a genetic evaluation and treatment at the cellular level are all very important ingredients for a healthy life.
Well, I like food, so how does food affect estrogen levels?
Well, first of all, food may have xenoestrogens. For example, milk may have xeno means foreign estrogens. Mm-hmm. And women also that use makeup with paraben in it, that can also increase your xenoestrogens.
As far as like it absorbs into the skin?
Yes.
Wow.
So you have to be aware that all of these things may affect.
I don't think a lot of women know that. As far as makeup,
yeah.
I mean, that's important to know. Just out of curiosity, I mean, I don't know if you know that, but what do you know of a makeup that happens to have? Because I'm thinking, oh my God, I need to check my makeup.
My answer is paraben-free makeup.
Paraben?
Paraben-free makeup.
What does that mean? What does paraben mean?
A wax.
A wax.
It's a type of wax, yeah.
So anything with that has.
I don't know all the various makeups, but I know paraben can have an effect on your estrogen level.
Wow, okay. Well, that's good to know. As far as birth control pills, how does that affect a woman?
I'm not in favor of birth control pills, but I think a woman has a right to take them if they want to, but they shut down the natural female cycle and may increase the risk of stroke, may increase the risk of long-term medical issues like osteoporosis, and increase a woman's risk for cancer by being exposed to exogenous, non-bioidentical estrogen and progesterone. A lot of the synthetic non-bioidentical hormone replacements are made from such things as horse urine, for example, with estrogen, and for progesterone, also some synthetic negative characteristics that can impact women adversely.
So this is across the board in all birth control that you're talking about that women take orally?
I don't know offhand every single birth control pill, but I would caution a woman to be careful when she's making that decision to use birth control pills.
Okay, well, that's important to know. I'm on a pretty regiment diet because of what I do. How does that affect estrogen?
Your diet?
Well, no,
I don't know your diet.
Well, no, not. I'm just saying in general.
In general,
but I know that I'm a pretty regiment as far as my diet, so I go from real extremes.
I think that having too much animal fat is anti-estrogenic. Okay. Having too much fat in your diet, especially protein that's contained from cow meat, red meat, too much alcohol in your diet can affect your estrogen levels.
Okay.
Stress.
And what about like chicken, or what would you recommend? Let me just put it that way.
Well,
as far as for women,
I would advise not a high protein diet, a relatively low protein diet. I would advise mostly fruits and vegetables. It depends on what your goals are. I'm talking about for the average person for health, not necessarily for bodybuilding, but just for, in general, health.
Yeah, no, I totally get that. But, that's
Paleolithic nutrition, what man ate in Stone Age times is what I recommend. It was good enough for him then, and I think it's still good enough for him today.
If you can't read it, you shouldn't be eating it, right? I totally believe in that. As far as how do they get in touch with you, if somebody is interested in getting a hold
Sure.
of you for bioidentical hormones?
My name is Dr. James Weiss. Thank you again, Lenore, for having me today. And my number is 210-438-9355. Again, 210-438-9355. I am a board-certified physician. I'm available at Health Crave 21 Spurs Lane. Thank you.
Awesome. Well, you know what? If anybody is driving around and can't get ride it fast enough, I don't want you to wreck. So you could always find that information on KaiserHealthTalk.com. The podcast is going to be downloaded tomorrow if you want to listen in on it again. And I would definitely recommend listening to it and getting a hold of them if you have any interest or have any symptoms in regards to that, because that's pretty important. Nobody wants to go crazy. Women are crazy.
No, we don't want our women to be crazy. We want them to be happy and healthy. Absolutely.
We're going to be taking a break, and when we get back, we're going to be talking to Eric Rogers and Bradley Strout in regards to a program for HRs and benefit managers that might have some interest in helping with the medical expenses. You're listening to Kaiser Health Talk, and I'm Lenore Kaiser.